How do we decide what patients need blood thinners after surgery? Like most decisions in medicine, it's made by comparing the risks and the benefits. The benefit of being on a blood thinner is that you would have a decreased risk of getting a blood clot after surgery. The risk is obviously then you have an increased risk of bleeding, either from the surgical site or a fall or anything that happens after surgery. So when we are trying to figure out for an individual patient whether or not we put them on blood thinners, we often use the Caprini score. The Caprini score is a calculator, and we put in different patient factors and surgical factors. It then pumps out a number. This number then gives a risk stratification of the patient's risk of having some type of clot after surgery, and then based on that makes a recommendation of whether or not they should be on a blood thinner. Like most calculators, this is just a recommendation. The surgeon then has to decide if they're going to agree with that recommendation. Sometimes, even if the calculator says the patient is not at a very high risk of having a blood clot, the surgeon still thinks it's a good idea to send the patient home on a short course of blood thinners. In microsurgical breast reconstruction, most surgeons do not send patients home on blood thinners. This study showed less than 2% of patients were sent home on blood thinners. This study also showed that to prevent one clotting event, you needed to treat 55 patients with a blood thinner. That's a pretty high ratio. Now, once again, this is very patient specific. These are just large population studies. If you have a big surgery coming up, it's a good idea to ask your surgeon, will you be on blood thinners after surgery? What is the risk of those blood thinners? How long will you be on them for? Is there a way to reverse the blood thinner if you would need to, say, go back to surgery for some type of surgical complication? If you've had microsurgical breast reconstruction, did your surgeon send you home on blood thinners? If so, let me know below.